Ladies and gentlemen, Dr. Lorenzo here with another quick Q&A. Been getting a lot of questions about bursitis. So any word with itis on the end denotes inflammation. So laryngitis, appendicitis, bursitis, it means that there's an inflammation process going on. Naturally, inflammation upsets the nerves and you're going to get pain. So a bursa, or bursae plural, is essentially like a fluid-filled sac. And you find them around big joints like your shoulder, your hip, your knee, elbow, these kinds of places. And they can become really stressed out and they can get really painful if they're subject to some kind of trauma, like a fall, or repetitive movements, like, working at a mouse, or you're working with a mouse, or if you're a hairdresser and constantly cutting hair, or you're constantly packing and loading something, anything where you're sort of doing repetitive actions, because essentially the bursa acts, it's a fat pad, it's a fluid-filled sac, which creates a smooth surface and essentially a surface in which certain structures like muscles and things can kind of glide over it. And in a perfect world, they're going to glide and glide and glide. They're not going to create any kind of rubbing, friction, inflammation response. But as we get a little bit older in life, we can have muscle imbalances, we can have traumas like falls and things like that, or we can have this repetitive injury or repetitive action as part of our jobs. We can't really escape it. So bursitis is something which is very, very real for a lot of people out there. And it can be very, very difficult to treat because, a lot of people can glaze over the fact that they've got some kind of issue there. And it isn't until they can either no longer perform a specific action or they can't sleep on their side because of hip pain or shoulder pain that they normally come and see us. Traditionally, if it's an acute bursitis, which means basically you've had it quite recently, it hasn't gone on for months or years, then bringing down that inflammation with cool and ice and things like that can really work wonders. Otherwise, if it's starting to move more into chronic territory where it has lasted sort of weeks, months, years, then it is always good to see a practitioner to determine if heat or cold is going to be better, to see if decompression of the joints is really going to work, to see if there's any kind of muscle wasting because you haven't been using that part of the body correctly. There's a lot of things which need to be considered in the diagnosis and treatment of it, but it's really, really, really easy to treat once you get a handle on exactly what it is. Traditionally, I find that a combination of heat-cold therapy, acupuncture, re-strengthening, mobilizing the joints, massage, all these different kinds of things work really, really well. So if you feel as though you are getting bursitis in some area of the body, come on in or see a practitioner wherever you are and just double check that it is in fact bursitis and go around getting treatment for that. So I hope that's enlightening to some of you. I'll do a few more videos in the not too distant future, so keep your eyes peeled.